All right, we are now recording. So basically, I wanted to ask you a few questions about, so my goal with this, I would like to do a series eventually where interviewing other therapists and asking questions about NST, about things you struggle with as a new therapist, how to build a business as a new therapist, that kind of thing. But since I know you've been doing massage therapy for a long time, like how long has it been? Like 15?
16 years.
Yeah, 16 years. So in talking to like Annika, so the two of us have only been doing this for 6 months and already like, oh, we're like, how can our hands handle this for much longer? What has been your secret to longevity? Like, how have you been able to do this for so long?
It's actually really simple. There's two parts. The first one is that you have to absolutely love it. Like if you don't come to work and you're happy every day, like I love my job so much. I get to meet really cool people and I get to help them feel better. Like, so loving what you do, I think is really important. And the second part is just taking care of yourself. So if that means taking a mental health day sometimes, or just physically taking care of yourself, like to me, being strong and getting stronger and building my core and building up my back strength has actually really helped me. So like I don't have any nagging neck issues or shoulder issues like a lot of my coworkers do. Like I know therapists who've been working 6 months. I know therapists that have been working 6 years. I know therapists who've been working 25 years. And the people that take care of themselves are the ones that are able to do it longer. So those are the two most important things.
And when you talk about building core strength and back strength, what kind of exercises do you do for that?
So I do a lot of yoga.
Okay. Yeah.
A lot of yoga. I haven't tried Pilates yet, but it looks like it would also do the same, have the same benefits.
Yeah.
I work out at the gym. I do lift weights. So lots of rows, lots of pull downs, just anything to counteract all of that pushing and engagement of the pecs and the anterior deltoid and stuff. So anything where I can engage like lower traps is great, rhomboids, the erectors even. Because I can tell when it's time for me to get worked on because my head posture starts to drop, like I start to come forward and all of this gets tight. So so you to open that up. But those have been the best things for me.
And do your like hands and forearms, like do your thumb joints hurt or bother you?
Yeah. My thumb hurts today.
Yeah.
Right there and there. I did a lot of neck work.
Yes.
On Sunday. And then on Monday. And then today wasn't too bad. So, but yeah, every now and then. My forearms are okay.
Okay.
I find that ice is very helpful when I overwork them.
So I used the cups on my forearms. I put them on the extensors here, and then like right here where this, I don't know, a flexor pollicis I think is attaches right here. It was like feeling really janky, and like after a couple of days, the pain was totally gone. Good. So who knows if it's psychosomatic or if it really helped, but
as long as you feel better.
Yeah, exactly.
But there have been weeks where I've done 30 massages, which is a lot for me.
Yeah.
Like, I don't usually like to do more than 20 to 25. And I've had to put my hands in buckets of ice water because they're so inflamed. But it works. It's just, I hate being cold.
Yeah.
So like I have to put the heating pad on my back and then put my hands in the ice water. So it kind of counteracts it. But I've had to do it. Ice works great when you overwork yourself.
So you said 20 to 25 is about the max of where you, okay.
Yeah. Any more than that, and I'm really going to feel it.
Yeah.
So that's no good.
Okay. So the next question that I had, and again, something that Annika and I have had a lot of discussions about, is we see a lot of patients that keep coming back to us every week, but we don't see a lot of changes like in their posture. And, like a lot of times they say they feel better, but we're not seeing, they feel better, but it seems like their posture is refacilitating and a lot of the same muscles will continue to be tight. So in your experience, are there a certain number of visits usually you need to see somebody before you can get to see changes, or?
It really depends on the person.
Okay.
And I know that's not a very good answer, but it's case by case.
Mm-hmm.
Some people, it's going to be management forever. Like
Oh.
if they're going to continue to do the same things that put them in this pain or put them in this pattern, then it's just, and you can have an honest conversation with them. Like if you're going to continue to play golf 3 days a week and
Yeah.
do this, then we're going to have to continually work at it. And most people are okay with that as long as you're honest with them.
Mm-hmm.
I find though that if I have just like we'll just say an average client with neck pain or low back pain, and you've looked at the chart and you've treated everything that you know to treat, and you're not getting a result, either a change in the chart or a decrease in pain, it's time to like think outside the box.
Okay.
So that's when I might start asking them about emotional stuff. Maybe
Mm-hmm.
is there an emotional component to your pain, or really start to dig in their medical history. So are you sure you were never in a car accident? Have you ever had surgeries? Did you like, you just have to start digging, because there's usually a reason why it's not changing.
Mm-hmm.
And it may not be anything to do with their body. It could be an emotional thing. That will usually be what I do if I don't see any type of change.
Okay.
So I would say after about 4 weeks or 4 treatments,
Okay.
it's time to take a new approach, because your regular approach, which works for 95% of people, isn't working with this person. So you have to think of a new plan with them.
Okay. So usually somebody comes in with like low back pain, neck pain. After about 4 visits, if it usually does go away unless there's something deeper.
There should be a decrease in pain.
Yeah.
If you're working the right muscles, or even most of the right muscles, you're giving them some sort of homework. They've made a commitment to change, right? So whether that means sitting properly at their desk or doing the stretches you're recommending, if they're doing all the right things and you're doing all the right things and there's no change, then it's time to take a step back and reevaluate everything.
Okay.
And I like to involve them in that process. Like I'm going to say, normally when someone comes in with low back pain and I've treated QL and psoas and TFL and the quads and the glutes and the hamstrings, I'm going to get some sort of change.
Yeah.
Is there something else that you haven't told me? Were you, did you fall as a child? Did you? And then they'll usually go, oh yeah, I fell and broke my tailbone when I was 7. Or they'll say, ever since my epidural, when I had my child, I've had this pain. And you may not have picked that up before. So you just basically have to like look at it again with fresh eyes. Like what am I missing? What component is missing here?
Okay. And if somebody does fall on their tailbone, what can we do about that?
I mean, if you send them for an x-ray, you're probably going to see if it's not in the right place. So that might be something that you would explore.
Okay.
But people forget to tell you things.
Right.
I had a guy who had been exploded twice in Afghanistan and didn't even tell me.
He'd been exploded?
He was exploded. He was a sniper.
Wow.
And he literally got exploded twice. And he still has shrapnel coming out of his body, but he forgot to tell me.
Oh, dang.
Yeah. I'm like, oh, this is maybe why your low back hurts. They had cement fly at you.
Yeah.
But yeah, it took three treatments to get to that.
Okay.
Just slipped his mind, apparently.
Yeah, right.
So they forget.
Oh,
They don't always correlate their current pain with something that's happened previously.
Oh, yeah, right.
So,
yeah, that makes sense. I guess it's easy to forget that after all of our education that we know. It's like sometimes I feel like I know nothing still, but it's hard. It's easy to forget that we still know a lot more than our patients do. So like something that would be obvious to us to bring up to a therapist, they might not even think it's meaningful.
Right. Like I had 3 C-sections, and on my last one, my stitches ripped open and I was back in the hospital. They may not think that has anything to do with their leg pain. Where it might.
Yeah. Because like the fascial connections and
Right. So you just have to educate them like, hey, sometimes low back pain is associated with a fear of loss. And you said your son's going away to college. Like, okay, so maybe you need to express your emotions a little bit, and that might help. So it's just simple things
Yeah.
that they don't necessarily understand, or sometimes I forget.
Yeah.
You know? Yeah. So.
And kind of along the same lines, since you've been in the field for so long and you've trained so many therapists, in the progression of a therapist, how long does it usually take somebody to feel comfortable and to feel like they know what they're doing and that like they don't suck? Because it's like, I feel like I question myself all the time. Like, am I doing this right? Am I helping this person?
I feel like that sometimes. But I can actually honestly answer this question. It takes about 2 years.
Okay.
After about 2 years after you finish school, so in the field,
Mm-hmm.
your things will finally click in your head where you're like, oh, okay, I've seen the same case, 27 times. This starts to make sense. But after 2 years, I felt like a full-time work. I felt like I was like, okay, I actually know what I'm doing now. Like, things are really starting to make sense. So I think all of us have a point where we're just like, this doesn't make any sense. I'm just going to try. But most of the time, you're going to feel confident, but it does take about 2 years.
All right. That makes me feel better. Because it's like you're in school and you take tests and you do well on the test, but it's like a completely different world when you get out there and you're working with the human body and there's no like right answers. There's nobody grading you and telling you if you're doing it right,
No, you just have to kind of go with it and hope it works. And then it does. If it doesn't, okay, let's try something else. But we all do that. It's trial and error. Because like I said, every single body is different. Every person's mind is different. So what worked for 10 other people with sciatica may not work for this person. So, but yeah, it takes a while.
Yeah.
Okay. Like any job. It's like any job. Like if you were a rocket scientist, I'm sure it would take you a couple years to feel like really good about being a rocket scientist. So
yeah. That's actually, it's a really good point. Cause if I think back on like any job I've had in the corporate world, like a year into it, you're like, yeah, I got this down. You don't expect to be like completely comfortable after like 3 or 6 months. But I guess for some reason you think, oh, I've been through school for 18 months and, it's instilled in us that you guys know so much and you can help so many people. It's like kind of a lot of pressure to just like jump out of the gate and be awesome.
Right. No, but it just takes the experience. It's all it does. It's just life teaching you now.
Yeah.
And it's called a massage practice, right? Just like yoga is a practice.
Yeah. I like that.
You're still practicing.
Okay. One last question and then I'll let you go. Okay. So one thing that concerns me,
entertaining myself,
is I still get like nervous when I work with people who have like disc herniations, and especially when I think about treating them and then also like teaching people with yoga that have like disc herniations and stuff. What, in your perspective as like a personal trainer and as a massage therapist, what are the contraindications? Like what should you not do for somebody who has a disc herniation, or what movement should you stay away from?
For disc herniations, I mean, whether it's cervical or lumbar, it's going to be pretty much the same. You really don't want to compress.
Okay.
So any type of compression where you're pressing the discs together.
Okay.
So if that's like dural tube mobilization, maybe you're only going to be doing the traction.
Sure.
And that feels really good to people if they have disc herniations. So traction. With the lumbar, things that I would advise against would be any type of like a deadlift or anything like that where they're picking up, right, and hinging.
Yeah.
And also anything with like the lift and twist. Because that's probably how they injured themselves if it wasn't a car accident, is that lifting and twisting motion. So I would advise against that. With the neck, I'm always going to just communicate with them if I do anything that causes any like pain or pins and needles that shoots down your arm or into your shoulder, let me know right away. I'm usually okay with side bending with that and rotation, as long as it's like reasonable. Like I'm not putting them through a range of motion. I'm just trying to get to the musculature. I've never had a problem with that.
Okay.
Like, so within like what would be considered a conservative range of motion, you shouldn't have any problems.
Okay. Well, and that was, I was thinking about, as far as teaching yoga, like we do so many spinal twists in yoga, and I've done some research, and it, like, sometimes spinal twists are contraindicated for people who have disc herniations, but like the spinal twist can also be good for spinal health, so I'm like, I'm so confused. You just like leave it up.
Why every instructor says, listen to your body.
Yeah, that was what I was going to say.
No, thank you. And your body, especially those lumbar ones, there's so much musculature there. It's going to seize, right? Like, it's going to like splint it so that you're not able to.
Okay.
Like, it's going to protect it. And that's why, like, people are usually coming and getting worked on, is because that musculature around the herniation is going to be so tight. It's the body protecting it. And unless the herniation is pressing on a nerve root, probably not going to have any pain. So it really just depends.
Okay.
But yeah, like, the only thing I wouldn't do is, you don't want to compress.
Okay.
So, like, if you were training, maybe like box jumps wouldn't be a good idea.
Oh, I hate box jumps.
The impact, But otherwise, if they're listening, if they're pretty in tune to their body and you're not having them do something crazy, like throw tires, that'd probably be okay.
Okay. Yeah, that's helpful. I need to get over it. I have like so much fear about hurting somebody. I don't know why.
I actually thought about that today. I was working on somebody's anterior neck, and I was like really going at it. And she's a very stoic European woman, and she's like, yeah, just do it. I'm like, okay. And I was thinking about that. I'm like, yeah, other people would probably be really afraid to do this, but it's really hard to hurt somebody, like structurally hurt somebody.
Yeah.
Like, if they're in a lot of pain and they have crazy trigger points, that's one thing. But like, you can't really, you're not going to break their, vertebrae going in there like that.
Right.
And if you're on their carotid artery, they'll pass out, or they'll tell you.
Yeah.
Or you'll feel it. Yeah. Like, I think as a new therapist, that was something that it took me a while to learn. Like, it's okay to go into the neck deeply. Like, if you warmed up the tissue and they're okay with it and you're okay with it. So I think that's probably one of the most valuable lessons I learned in that first 2 years, is like, you can really attack the tissue. You don't have to be afraid. People will tell you if you're hurting them, or you'll be able to see signals, clenching, and their breathing will change, but it's pretty difficult.
Yeah. Well, and to that point, it raised an issue I had earlier in the week, which was I had a patient, and she was super ticklish everywhere. Like when I touched her ASISs, or even when I was framing her kneecaps to see which direction they were facing to check for rotation, like she was ticklish everywhere and very, very sensitive. So when you encounter, like I tried to work her quads because she also has high pelvic flexion, and they were super sensitive too. So I just resorted to just doing some myofascial release on them. What do you usually do when you have a patient who, because the tickle sensation is kind of like a signal of an amped up nervous system, isn't it?
Yes, exactly. So I actually had this happen to me a couple of weeks ago. I have a new patient. She was in a car accident. I think I was telling you about her. She got rear-ended.
Right.
She was turning to the left. So her temporal bones are shifted. Her C1 and C2 are both rotated to the left, but I could barely touch her. She was in pain, but she was so hypersensitive to touch. Like, she would just twitch and grunt because she didn't want to cry. Like, she did cry. That was an emotional thing though.
Yeah.
She was just so upset because she's 36 and she can't play tennis or do anything because she's in so much pain.
Yeah.
So I did a lot of traction and then corrections for C1 and C2 and the temporal bones. And then a lot of what I did was just me kind of holding one hand on her, whether it was her shoulder or her arm, and then just doing a little bit of compression, maybe a little compression with a twist. She came in, so that was 3 weeks ago. She came in last week, and she's seeing another therapist as well. She's able to tolerate now. Like, she can take the pressure. Like, we've been able to kind of deregulate her. But she's also 100% behind wanting to get better.
Yeah.
And she's like, you do what you need to do. I will be okay. I can take this. So she is sold, and she's having great results. Like, she's upright and not in pain all the time now, and she can be touched.
Awesome.
Yeah. So And at first I was like, I'm not doing the right things at all. I don't know what to do with her. But I was like, I'm just going to trust the training, right?
Yeah.
Trust the process. And it's worked with her. So she's doing great. She still has anxiety about being in a car, but I think we're going to get there because of the accident. She's super anxious. What are you showing me?
Can you see? This is my mantra for today. I trust Heather.
Good, you should.
But that is, it's like, so much of it I feel just boils down to that, especially when you live in indecision because you don't really know 100% of what you're doing yet. You just gotta, like you said, trust the process. And
just trust. I was like, I have no idea, but I'm going to do what I'm supposed to do for her. Right? Like I knew, okay, this is what I should do. The next time I saw her, we did anterior neck. We corrected C1, C2 again. They were less distorted. So that's good. And I'm like, okay, this is going to be fine. Like she's on board. She's willing to come twice a week. She's been coming twice a week for 3 weeks. She was so happy. She started crying. She's like, you're amazing. I'm like, no, it's not me. It's you. You're healing you. I'm like, I'm just helping you. And she's just like, I feel so much better. Like, because she just thought she was going to be in pain forever because she doesn't want to take drugs.
Yeah.
She didn't want neck surgery or anything. She has, I think, 5 cervical herniations and like 6 or 7 or like 3 lumbar herniations.
Oh, wow.
So she's like, oh, I'm like, okay, that makes sense. You got hit twice. So, but she's ready to heal. Like,
yeah.
And that's
Her
great.
mindset's right. Yeah.
Yeah.
That's awesome.
Yeah. So she's coming in tomorrow, so we'll see how she's doing, but I don't have to hold back anymore. Like I can go full pressure and she's able to tolerate it. It's still painful, but she doesn't start twitching and crying. So I just, I jumped off the bridge and took a leap of faith and I was like, I'm going to trust the process here. And it worked. So hopefully she'll have the results she wants.
Yeah.
But yeah, it's challenging when they're super ticklish.
Yeah.
It's a little irritating.
Yeah.
Slower and deeper.
Okay.
That also helps. Slower and deeper. If you're working a place where they can have their hand touching their body nearby, like if you're doing the quad and you're getting up into the hip, have them put their hand on their body because that'll trick the nervous system a little bit.
Okay.
You can't tickle yourself. It's true.
It's too bad.
You can't tickle yourself, so you just use that. But slower and deeper.
Okay. I'll try that on it. It makes it hard to take the measurements though, even because I'm like trying to get into. Yeah, that's what I did.
Just check real fast and like, too ticklish. Right on the chart, too ticklish.
I think I did.
Yeah.
Oh, all right. Well, thanks, Kelly.
Yeah, I hope I helped.
Yeah, you did. So if I end up posting this, here, let me